this morning, I'll be discussing causes of infertility. I'll be discussing causes of infertility, and I'm going to be brief about it, right? So let's jump right into it. So we are talking about causes of infertility. Causes of infertility. Let me change this pen. It is pertinent to mention that all diseases arise from two unwavering roots. Yes, all diseases arise from two unwavering roots. We talk about nutritional dysfunction. We talk about nutritional dysfunction. Nutritional dysfunction and toxicity buildup. Toxicity buildup. Yes. All diseases arise from two unwavering roots: nutritional dysfunction and toxicity buildup, right? Now, when we talk about nutritional dysfunction can be nutritional deficiency or overnutrition. When your body is not getting the necessary nutrients it needs to function properly, we call it nutritional dysfunction. And when your body is unable to use effectively the nutrients your body needs, we call it overnutrition. So nutritional dysfunction can be overnutrition or nutritional deficiency. That being said, when you talk about reproduction, essentially, nutrition plays critical roles. Let's talk about nutrition. Basically controls what we call hormonal synthesis, right? When you talk about reproduction, nutrition controls hormonal synthesis, right? Nutrition controls hormonal synthesis. Nutrition controls gamete development, right? Gamete development. Nutrition controls gamete development. Here I mean your sperm and then the eggs, right? Yes. Gamete development. Nutrition equally controls implantation. Nutrition controls implantation. Of course, nutrition helps in maintaining what? Pregnancy maintenance. It helps in maintaining pregnancy maintenance, yes. Nutrition helps in pregnancy maintenance, right? So generally, when you talk about nutrition controls all of these things, right? Now, let us go into specific. Let us go into specific how nutrition actually influences reproduction. How nutrition is central to what? Infertility. Let's assume that a woman presents with no ovulation, what we call anovulation, or poor endometriosis, or abnormal ovum formation, right? So let's say anovulation here. Anovulation. Such a woman may ostensibly be lacking what we call folate, right? Or vitamin B12. Yes, that's the cause. When a woman is not ovulating, or there is, poor abnormal ovum formation, this woman is ostensibly lacking folate or vitamin B12. Now, we talk about, polycystic ovarian syndrome. You see people with a lot of polycystic ovarian syndrome. It is often said that it is a cause of infertility. But what is central to polycystic ovarian syndrome? Polycystic ovarian syndrome, PCOS, is actually as a result of vitamin D. Like the woman is low on vitamin D. So if you are low on vitamin D, you are most likely going to have polycystic ovarian syndrome, right? Now, we talk about we talked about anovulation. When you have irregular cycles, you have irregular cycles. Irregular cycle could result from thyroid dysfunction, and you know that thyroid dysfunction essentially leads to irregular cycle. So when you have irregular cycle, you have irregular cycles. It is as a result of dysfunctional thyroid leading to what? Irregular cycle. Irregular cycle could be central to iodine. could be central to iodine. If you are low on iodine or you are low on selenium, right? If you are low on iodine or you are low on selenium, you are most likely to have irregular cycle. That is the reality of it. Now, what other abnormalities can you think of in women? What other abnormalities can you think of in women? We've talked about anovulation, polycystic ovarian syndrome, irregular cycle. You may have poor ovarian or let's think about poor endometrial development. When you have poor endometrial development, poor endometrial development could be as a result of what? Deficiency in proteins. Poor endometrial development could be as a result of deficiency in proteins. Now you may have endometriosis, what we call inflammation. Endometritis, we call endometrial inflammation, right? We have endometrial inflammation. It could be central to what? We talk about omega-3 fatty acid. It could be central to omega-3 fatty acid, right? Omega-3 fatty acid. So these are some of the nutritional requirements in fertility abnormality. It could be anovulation, polycystic ovarian syndrome, irregular cycle, poor endometrial development. You talk about endometriosis. They are all central to nutritional deficiency. That is in female. Now let's jump right into males. Right? Let's jump right into male. What nutrition can do in male fertility, or how nutrition contributes to male infertility. So let's use this. Let's use this, right? We jump right into it. In male generally, right? When you are low on testosterone, when a man presents with low testosterone, right? A man presents with low testosterone, right? Or poor spermatogenesis, what we call sperm formation, spermatogenesis. This man is most likely lacking zinc. Yes, this man is lacking zinc. When you have low testosterone and poor spermatogenesis, this man is lacking zinc. That's the reality of it. Now we talk about somebody that has impaired motility and morphology. A man may present with impaired motility and morphology, right? We talk about impaired sperm motility and morphology. Impaired sperm motility and morphology. This man may most likely be low on what? Magnesium. The man may be low on magnesium and calcium. The man may be low on magnesium and calcium. That is the reality. When a man presents with, let's say, poor sperm DNA formation, right? When a man presents with poor sperm DNA formation, let's say sperm DNA formation, or what we call DNA fragmentation, sperm DNA fragmentation. This man may most likely be low on antioxidant. Yeah, notably we talk about vitamin E, vitamin C, selenium, right? Selenium CoQ10. Yeah, this man is most likely be low on all of these things you are seeing. So sperm DNA formation, like poor sperm DNA formation. Let's move further. When a man has poor sperm membrane, right? We talk about poor sperm membrane. When a man has poor sperm membrane, this man is ostensibly lacking omega-3. Yes. This man is lacking omega-3. So you can see some of the abnormalities that nutrition can actually cause. Deficiency of nutrition can cause in men and women as regards what? Infertility. Now, being said, remember I told you that every disease arises from two unwavering sources, right? Nutritional dysfunction and toxicity buildup. Now, I have discussed nutritional dysfunction both in men and in women. So let's go to what? Toxicity buildup, right? Very quickly, we go to toxicity buildup as the second arm. Now we are going to use, maybe we use this. So toxicity buildup. Toxicity buildup. Buildup. We talk about toxicity buildup, right? Now it is pertinent to mention that buildup of toxicity in one system can cause several things. Buildup of toxicity can result to inflammation, right? Buildup of toxicity can result to inflammation. It can result to, hormone disruption, hormonal disruption. It can result to hormonal disruption. It can result to cellular stress. It can result to damage to DNA. It can result to damage to DNA. That is an overview, right? So toxicity buildup can result to all of these things. Now, let us go into specific, right? Now, when we talk about toxicity buildup, there are basically two sources of toxicity buildup. Toxicity can come from either what we call biological particles. Toxicity can come from biological particles, and toxicity can equally come from what we call anthropogenic toxicant. Toxicity can come from biological particles and it can come from anthropogenic toxicant, right? Now, when we talk about biological particles, we are literally referring to microorganisms, right? Biological particles, we are referring to microorganisms. Now, this microorganism can be bacteria, right? It can be viruses. It can be parasites. It can be fungi. It can be atypical bacteria. Of course, they are equally called bacteria, just that they are typical, right? It could be caused by all of these things. So when we talk about biological particles, these are some of the things we mentioned, right? That being said, let us go into specific, right? Now, what do you think? These microorganisms, like they are ubiquitous. They are found everywhere in nature. And when you have a dysfunctional immune system, they can cause a whole lot of harm in your body, in your system. That's the reality. Although they are good, they are normal flora, they aid in so many things, so many beautiful things in our system. But once there is a dysfunctional immune system, they cause a whole harm in one's body. Now let's go right into it. Let us see that the cause of a woman's blocked fallopian tube, like a woman present with blocked fallopian tube, a woman's cause of blocked fallopian tube could be as a result of sexually transmitted diseases or sexually transmitted infection, as the case may be, right? Now, pathogenic microorganisms that we suspect when it comes to tuber blockage, they are basically chlamydia. We suspect chlamydia. We suspect gonorrhea, right? We suspect chlamydia. We suspect gonorrhea. They are the major culprits when we talk about blocked fallopian tubes, right? Now, what other abnormality do you think a woman can present with? When a woman presents with chronic cervicitis, when a woman presents with chronic cervicitis, such a woman may most likely be infected with pathogenic microorganisms. Here we talk about atypical bacteria. Majorly, mycoplasma, and then we talk about uroplasma. Yeah, these are some of the microorganisms we query when a woman presents with chronic cervicitis, right? Let's go right into assuming a woman presents with what we call severe infertility, right? A woman may have what we call severe infertility. Severe infertility. Now, severe infertility could be central to TB, tuberculosis of the reproductive tract. Tuberculosis of the reproductive tract, right? So you see, a woman may present with all of these abnormalities. Do you understand? They are as a result of what? Pathogenic microorganisms. So when infections are left untreated, chronic infection, it can lead to all of these abnormalities in what? In women, right? Now, let's jump right into what this thing can cause, pathogenic microorganism can cause in male, right? Let's talk about male infertility and what pathogenic microorganism can cause. Actually. So you may see that some people may present with what we call inflammation of the testes, or what we call orchitis. Let's say you have orchitis, or you have epididymitis. You know, orchitis is the inflammation of the testes. Epididymitis is just the inflammation of the tube that conveys sperm cell, right? So when you have this inflammation, as a man, this thing may most likely be caused by bacterial and viral infection. STI can cause this inflammation. And then moms, we talk about moms. Moms can actually cause this thing, right? So we talk about orchitis, epididymitis, right? Now, what other abnormalities can you think of in men? What other abnormality can you think of in men? A man may present with what? Poor motility, poor sperm motility and morphology. Poor sperm motility and morphology. No, so we have poor sperm motility / morphology, right? Now, this thing may be caused by STI too, pathogenic microorganism. And here we question mycoplasma, and then we question what? Uroplasma. You right? Poor sperm motility and morphology, right? So a man may present with what? Low sperm count. When we talk about low, sperm count, low sperm count may equally be central to pathogenic microorganism. We query gonorrhea, right? We query, we query gonorrhea, we query a whole lot of atypical bacteria. Do you understand? So in men, this abnormality, these are some of the abnormalities that can happen in men, and these abnormalities are basically central to what? Microorganisms. They are central to microorganisms, right? Now, let us go back. Now, we've talked about biological particles, right? In men and biological particles in women. What microorganism can cause in men and what microorganism can cause in women. These are some of the things, right? Now, let's move on to what we call anthropogenic toxicants, right? We say that toxicity buildup or toxin can come from either biological particles or anthropogenic toxicant. We have discussed biological particles, right? And we've discussed it under men and under women. Now let's go to what? Anthropogenic toxicant, right? When we talk about anthropogenic toxicant, we are referring to toxins essentially. These toxins can be, let's say, anthropogenic toxicant. This toxicant can cause a whole lot of abnormalities in the system. That they can cause hormonal disruption, they can damage your DNA, they can cause inflammation, they can cause so many things in your system. Now, notably, when you talk about anthropogenic toxicant, we are referring to herbicide, referring to pesticide, we are referring to heavy metals, we are referring to chemotherapy, we're referring to radiation, we are referring to, tobacco, we are referring to tobacco smoke, referring to industrial fumes, we are referring to, excess alcohol, referring to excess, alcohol, a whole lot of these. These are what we call what? Anthropogenic toxicant. Now, let it be known that anthropogenic toxicity, right? Anthropogenic toxicity is the fastest growing cause of infertility. Anthropogenic toxicity is the fastest growing cause of infertility. Yeah. Now, what they do, let's think about what they do in men. The essential thing is that whatever nutritional dysfunction can do in women, right? So whatever nutritional dysfunction can do in women, whatever biological particles can do in women, anthropogenic toxicants can equally do. So let's think about some of the abnormalities, right? We talk about blockage of fallopian tube. Anthropogenic toxicants can do it. We talk about, endometritis, inflammation of the endometrium. We talk about poor ovarian development. We talk about cervicitis, right? All of these can result from what? Anthropogenic toxicants in women. Now, all what we talked about in men, male infertility, we talk about poor sperm formation, we talk about low testosterone, we talk about testicular atrophy. Talk about testicular atrophy, shrinkage of the testes. We talk about DNA fragmentation, sperm DNA fragmentation, right? We talk about all of the abnormalities you can think of. Anthropogenic toxicants can cause them. So that is why it is the fastest growing, cause of infertility worldwide. Anthropogenic toxicity is the fastest growing cause of infertility worldwide. It can cause low sperm count, so many things. So today I have discussed causes of infertility. And I've explained that every disease, all diseases arise from two unwavering sources. We talk about nutritional dysfunction and then toxicity buildup. Under nutritional dysfunction, we have talked about some of the abnormalities that can result from what? Nutritional dysfunction in men and in women. Now we have talked about anthropogenic toxicant, right? Toxicity buildup. Under it, we talk about anthropogenic toxicant and biological particles. All the abnormalities that can come from biological particles in men and in women we have discussed. And then under anthropogenic toxicants, all the abnormalities that can come from what? Men and women as regards toxicity, anthropogenic toxicity, we have discussed that. So this is about how far we can go in discussing sources of or causes of infertility. If you want to reverse your infertility, is to make sure that you follow this thing. You know, where you are low, you increase it. If you are exposed to sexually transmitted infection, you treat appropriately and all that. With that,